Hello to everyone who watch us. I am Sakalauskienė, and today we have very special guest, Vitaly Mikryukov. And please introduce yourself, Vitaly.
Hello, it's nice to see you, and I very appreciate your invitation to this video. Okay, my name is Vitaly. I am Ph.D. in medicine. I'm a medical doctor, surgeon, cosmetologist, and a specialist in laser tattoo removal with experience for more than 15 years in this field.
So today we have very painful, very interesting topic about fresh tattoo and permanent makeup removal. Sometimes we call emergency tattoo removal. So, of course, today I'd like to know your opinion because there are so many risks, and maybe you will share with us, about all these things.
It's a very interesting topic about the fresh permanent makeup removal or emergency tattoo and permanent makeup removal. And I have opinion. I'm in most of cases I'm against of such procedures, and I try to explain you why I think in such way. First of all, the skin is traumatized by previous application of permanent makeup or tattoo. Sometimes permanent makeup artists see their mistake, they understand that they make mistake and try to solve this problem right in the procedure. But sometimes people regret of the permanent makeup or tattoo in near days, 1 or 2 days or few hours after the procedure, and try to find the way how to remove their undesirable permanent makeup or tattoo in fast way. But I try to explain to my students that this is not a good idea because the skin is traumatized, and the injury of the procedure by the needle mechanical injury is pretty high. And in this way, I prefer and I advise to the artists to leave the permanent makeup or tattoo for the regeneration of the skin, for the time needed to regeneration, due to the few reasons. This decrease risks of additional trauma and getting complications after the procedure, especially if you are not experienced in laser removal or chemical removal in this field. The next reason is that you don't see the real residue of pigment in the skin right after the procedure or a few days after the procedure, because the epidermis is stained by the ink particles and it needs to be renewed to see the real residue. Possibly, maybe the residue of some mistakes of permanent makeup artists will be minimal, or even there is no residue of pigment in such places which you want to remove. That's why it's better to wait and to see the real residue of pigment in the skin. And moreover, I explained that it's better to wait a little bit further because in the first 3 months after applying the permanent makeup or tattoo, approximately 30% of ink introduced into the skin leave the skin in the natural way with the immune system, with the reaction of inflammation. And that's why after the period of regeneration of the skin plus few months, you will have not so much ink particles in the skin, and it will be easier to remove it, both way, maybe in laser removal or chemical removal. That's why I understand patients very well, because they're nervous, they may crying, they have not stable psychological state after they have tattoo, and they really want to remove it much more faster. And but the better way is to wait, give the skin time to regeneration, and a little bit more to decrease the ink particles, the amount of ink particles in the skin. After this, you will see the residue, you will see the amount of the ink particles, and then you can decide which way you will choose, laser removal or chemical removal, and you can start to delicate procedures of removing, because after after application of tattoo, in even few months will pass, you need to be very, very delicate and accurate, because the risk of complications is very high in comparison with the old one permanent makeup or old one tattoo. That's why I try to explain this to my students, these tactics, this strategy, and I try to warn the clients not to try find in the internet some recipes, some advices how to remove tattoo or permanent makeup at home with easy way, with some acids or something like this. Not do it in yourself,
Right.
because it's really, yes, it's because they try to find, they are psychologically unstable, and they try to find the thing that this is a magical way. I will put something on my tattoo, make some scratches, and it will disappear. No, it leads in 99% to the complications, to the scars, and it's very, 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 very dangerous. This is my opinion on this topic. Yes, but I understand that sometimes if the specialist is experienced in chemical removal and want to help to the person, and it's possible, okay, it's maybe, but the specialists need to understand that the risks are much more higher than you wait time, and after everything you will start your removal procedure. This is my opinion, and I try to explain this to my students and to the audience. Okay.
That's nice. Of course, your position is very clear. You are telling for us very logical way how better it's to wait until we'll be healed. But I'm working in permanent makeup field. So I am like expert in this. And sometimes when client comes to me, I really can say that here is horrible work or here is beautiful work. You just need to wait until it will be healed. And of course, I calm all these clients. And why this decision to remove fresh emergency works came to me, I just explained, I am also was not fan of this, because it's much better always to wait until it will be healed results. So as I told you, I started to work on 1918 because this industry required something very special. And I worked this time in the Phi Academy, and I really was pushed to do something boom, like boom. Big academy always requires something boom. Okay, so I found the one model after permanent makeup training, and these eyebrows were really horrible made. It was uneven shape. It was the color very strange, little bit for this lady, too much yellow, and I could suppose what will happen when it will be healed. And, I started to think about before to do with such procedure this way, okay, we insert pigment, later we have microphagocytosis, and this pigment will be in a special protein envelope, it will be healed in some tissues, fixed everything. And when you like to remove, in this case, when it will be healed, of course, it requires already several procedures, but not one, And of course, again, that time, healing time, because in this time, I just used the one thing, chemical removal. So again, my client will be in the scabs, during all weeks, So it pushed me to do some decisions. So I tried, to do this procedure. I will start my presentation. I will show my first work ever. And of course, it's not so proud of them, but because why I'm not so proud? Result was really perfect, but maybe I was working too long, and the healing took about 7 weeks. It's not normal. Some traces still was visible in the skin, because actually I use some needles, Later, I stopped to use needles. I just work now with their special micro brushes. And this is beginning, how to remove fresh made permanent makeup. It was the next day after permanent makeup procedure. But okay, this healing was not so bad, so I started to continue. And for example, this eyebrows already looks much better. And here is next day after procedure, the client was adequate, it what means adequate. It just, she agreed that she was still not ready for this procedure. And she wanted to remove because, she felt very strange. And I really felt her feeling, And sometimes we choose our clients by our intuition. And we need always to agree that sometimes we really avoid some clients, but this client was absolutely normal, And this healing was really excellent. One time we can watch this. So just apply my product in this time, what I used, and okay, it was about 10 days about healing, You don't need to use absolutely any needles. Because with the needles, yes, you're making secondary trauma and it affects very bad old tissues. So everything is fine. This is right after procedure. And here it looks like that. And Vitaly, what I still notice, you don't need to struggle to remove all pigment in the skin during this fresh emergency removal. Some parts of pigment needs to stay in the skin. To compare with my first work in my career on fresh removal, so we can see still that I was struggling, to remove to zero, It was my small mistake in the beginning. But here you just apply, pigment becomes very soft. So you just see some remains of pigment in the skin and you leave like this to heal and everything will be fine. Well, so once again, we can look to fresh tattoo. Oh, this tattoo has really big history, I tell you. It was made on my husband's leg. The history was like that. Next day, I needed to have a student from France. She came just for my non-laser removal training, and my model, I don't know, disappeared, disappeared. I don't have any tattoo model. So I made during night this crazy tattoo on my husband's leg. So, and okay, so I could already after that each day, to look to healing. Now we can watch all this healing, every day. We also know that it was made on the leg, whereas healing usually is complicated, Yeah. So, of course, it was a long healing. But we were traveling to next countries to have my trainings. So I could always to make, pictures. And it was really successful because maybe it was superficial. It was made with permanent makeup machine, not tattoo machine, But this again pushed me, to make some searches how to do it. And I really decided that, yes, this is possible to remove, right after. And when it will be healed, of course, it will be also a long story if you like to remove to zero, So what do you think about?
I want to make some accents. It's much more risky to make the emergency removal and any removals on the body. It's with any
Yes.
method, laser, chemical removal, emergency chemical removal. It's anyway, it's much more risky than to work on the face. Usually clients think that there is more responsibility and more risks when you work with face, with eyebrows, lips, and other permanent makeup zones. But the skin of the face is much more better, have the much more better ability to regeneration. It's much more blood supply, and it can tolerate more aggression and can avoid of scarring, and regeneration will be normal even with a more aggressive action, both methods, laser, chemical removal. But on the skin of the body, its risk increases, and especially on the downside of on the legs, on the folds, and so much more risky because the blood flow is lower, regeneration is lower, and complications and scar formation is much more probable in such areas than on the face. That's why I don't like really when somebody try to remove black tattoo on the leg with chemical method, because it's the indication for the laser removal. And even laser removal, you need to be accurate, delicate, and understand the risks. This is very important. And I want to ask you, you are not using now the needles, machines, you use only the some solution, some chemical removal system, and micro brushes, and not use the needles and permanent makeup machines.
It's a very nice question, thank you. I use usually micro brushes. Also, it's very important how long it stays on the skin with special product, right? It's in between 3 or 5 minutes. It softens the skin surface, and I start already with special motions to work. Here was not all motions showed in the first, my slideshow. But the thing is that this procedure is very short, absolutely very short. I need to be sure when later, because this is based on glycolic acid that is good neutralized after this procedure. And after that, about needles. Just in very rare cases, I use needles just a little bit if I feel that the pigment is very good fix in some places. I just take and very gentle move with some special movements. Sometimes I feel really from what direction I need to work. It's hard to explain, but you need to feel it, just to feel the skin. And that's why not so much intervention with very sharp tools. That's it. No machines. Never I use any machine on thresh emergency removal. This is true.
So interesting. It's very good that you are, as I understand, you use neutralizer, yes, to neutralize the action of the solution. It's very wise. I agree with this, and I advise to people who use chemical removers, acid maybe chemical removers, always to neutralize and stop the reaction and aggression to the skin. It must be very, very short time and not so prolonged and not so aggressive. That's why you don't push the limit and don't go through the threshold of destruction of the skin and getting complications. It's very important to understand the ability of skin to regenerate and understand how much injury you apply to the skin and control this. This is main point where everybody made the mistakes. They do not control trauma, not control, and trauma is going increases, and it leads to some complication and scar formation. It's main point, main reason.
Yes, to control is very important. When you see already, open skin, without any epidermis, and you apply chemical peel on, of course, you need to be just you and your client in one, You need to see signs of the skin. Does it go a little bit deeper, if you start already to see uneven relief, in the skin, it's already a sign that you are going too deep. Of course, then immediately neutralizer. Even you see some traces of, not traces, but some remains of pigment, you need to stop your work already. And okay, so let's do now other case, So sometimes some clients, they come, for real help. And this client was writing me to the Facebook, I can't sleep. I can't, imagine what to do, because I got these eyebrows and please help me. In some cases, I just remove, just few details from eyebrows. And of course, after that, we are waiting until it will be healed. And after that, we can already, and after that, we can to do already new eyebrows or repaired eyebrows already. So here you can see how it was healed after some details after removal. And after that, I did what I could do, on such kind of eyebrows, So you can't, we discussed at first with the client, maybe you like to remove all eyebrows. And after that, I will have other concept of your eyebrows, but they say, they are too thick, maybe they are, too long or too short, So I start to think, and maybe just, part of eyebrows, it can be removed, and it will be just less trauma for client, and healing will be much more shorter. So in this case, was like that. But now I will show for you this case, for example. This lady, she came to us with beautiful lips, actually. I will explain everything from the beginning. So 1 year before, she came with her grandma, and we removed successful with laser eyebrows. And she asked also, maybe you can remove with this lips. I asked, my goodness, these beautiful lips, you are looking very nice. So what is wrong with these lips, She said, I can't live with this. And okay, I knew her before. She was adequate client, and she was writing me, okay, I said, but you know that you will have after the scalp, 1 week, and after that, this beautiful color will disappear. You will be again satisfied with your natural lips. She said, yes. So we decided to remove after 6 days when was made with lips, So let's start from beginning, and you will see during procedure how does it looks, So it's not a big actually trauma when you work with micro brushes. And the scalp, of course, it will be formed, and sometimes it's not thick scalp, but the client, if they like, to have unwanted pigment get rid, they agree with this, So after 8 days, you can get already again your normal lips. And again, I will come back to my decision, If you know that your client is adequate at first, and you really see this big wish to remove, and you can do it in safe way, so it's better to remove as soon as it's possible, as I noticed. But you don't need to use any machines, I tell you, because machines, they have this special vibration and this power, very special power. So usually I use just manual tool or micro brushes, no machines, never. So it brings enough successful results, sometimes super results,
I want to add something. The lips is good zone
Yes.
for removal because there are very great blood supply and regeneration. Even if the trauma will be very prominent, it will be very big trauma, lips can cope with this. Can cope, really can cope. And another one point, it's a partial removal. I try to explain to my students, to everybody, that the smaller the area of removal, chemical, laser, the smaller the risks. It's if you are increasing the area, increasing the amount of tissue are involved in such process, you're increasing the risks. That's why the partial removal, permanent makeup, or even maybe some details of tattoo is much more better than total work on the whole area. All these things you need to take into account. And moreover, I want to say my point. You need to watch and look to your client, the age, the situation with skin, the bad habits, because for example, smoking is decreased the ability of skin to regenerate. Even the big difference between two persons, one is smoker and one is not smoker. The skin will react differently. The age, young age, old age, it's different ability of regeneration. You need all of these factors taken into account when you make the decision to remove or not to remove in every particular case. It's really very precise decision you need to make and take into account a lot of factors. It's I think it's very important to explain to the person, to the specialist. Mm-hmm.
Yes, and dear Vitaly, I really totally agree, but I know what will happen if in this pigment is enough titanium dioxide, for example, and the lips are enlarged a little bit, or sometimes a big area is enlarged, and this picture is far away from authentic shape of the lips. And when you like to remove, when it is healed already, it takes, it's much more risky, I tell you. I need again to repeat that if titanium dioxide is there and nude colors with camouflage colors here, oh my goodness, it's a very big challenger to remove, actually.
Yes, I agree. Titanium dioxide is a very big problem, especially for laser removal, because it's not absorb any laser wavelengths, and moreover, it's go to the paradoxical darkening when you work with the titanium dioxide with 532 nanometer wavelengths of Q-switch laser. And after this, it's become more resistant to further laser removal. It's always problem. And in titanium dioxide, my advice is not to proceed if you see the camouflage, white color, a lot of white color, or some cover-ups of white color on tattoo or permanent makeup. Do not proceed it with laser, because it will be much more harder to remove it in the future than if you are not work with laser. And in such case, the chemical removal is one of the solution how to solve this problem. And I think this emergency removal is the mechanism of such emergency removal is like you little bit increase trauma to the skin, and after this form the scabs, and it's look like maybe more aggressive permanent makeup. It's like when the not good artist, not so skillful master apply a lot of passes with the machine and make a little bit trauma with the forming of the scabs. In such case, you really not so much pigment particles incorporate in skin, and the residue of the pigment is lower than with gentle work because of the scabs, because of the leaving such some ink particles with these scabs, with this trauma, inflammation, and all of this. And as I understand, this emergency removal is like modeling such situation. You increase the inflammation, increase trauma, and try to make it not so much ink incorporate, not so much ink particles incorporate into the dermis and stay in the skin. It's interesting idea. Yes, it's
It's just one of ideas, how to remove unwanted pigment. And next thing is, of course, I'm working on titanium dioxide on eyebrows, on lips area. And I need to say then titanium dioxide leaves the skin, the healing is also much more longer. It takes more time because it's like a part of big piece of, sorry, I will not use this word, So leaves the skin. It's always like emptiness, little bit temporary emptiness stays in the skin. It depends how long it was in the skin also. So it comes out like with full fibrosis, And of course, yeah, we use special ointments to help it to heal. But anyway, it's possible. Yeah. So good. We have one case more. When you are permanent makeup artist, it's very difficult to find someone who will realize your idea or something like that. And I was choosing very good master. Everything was fine. We made small discussion during my work, and I got up and I see, oh my goodness, double tail, double tail. I had before eyebrows. And so I came home, of course, and started to think, well, I think so that God sent to me, this case to try on my skin to do removal, an emergency removal. So I did after 3 days after this because I still couldn't find the right time, and was thinking how to do by myself. It's not comfortable to do by myself. But anyway, I did, So I used not only acidic removal, I used also alkaline removal you can imagine, on the fresh emergency case. And the healing took 1 week. It was still a little bit red, like inflammation inside. But after 2 weeks, it was absolutely normal. So I have 1 tail instead of 2 tails. And today I can really say that it's possible to work with 2 different, absolutely, in principle, removals in emergency case.
It's a really interesting case, and the small area helps you with some complication because it's
Exactly.
really very small. But the location of these tails is on the temporal part of the skin, and the skin here is much more thinner, and the risk a little bit increases. And both of these factors are balance each other. Small area, but on the thin skin, but you are a good specialist and you understand what you do, and moreover, it's your skin. Yes, and this is a really good thing. You can make experience. I have a lot of experience on myself. I have some little bit tattoos here. I make drama to myself, try to modulate some drama on my shoulders. And this is really interesting to feel on your skin how it goes. What feel your clients, what they think about this. And this is really very interesting, and it's really a good idea.
But the thing was that absolutely not painful for me was, in case I need to say that we use prenumbing before chemical removal procedures, but never secondary, because it closes the tissues, not good reaction because of epinephrine, on many other factors. And also it's very dangerous to use anesthesia during procedure. So I need to say to everyone honestly that it was absolutely not painful. Even it took more time usually when I work with other clients, because for myself it was not easy to do it. And in this case also I use a manual tool and some needles because it was not comfortable to work actually. So again, 2 risky factors, needle, 2 different removals, but small detail, But again, thin skin in this area. But fresh emergency and 3 days before made not removal but permanent makeup also was removed very successful.
Mm-hmm. No, it's good cases. It's very interesting cases. But what I want to say is, I'm against anesthesia. Even the first or first or secondary, I not agree because it's from my medical point of view, it increases risks of unusual reactions of the skin, unusual processes, because you are make the impact to the normal process of inflammation. And because it's make the spasm of vessels or dilation of vessels, it's change the process of inflammation. It really can make the bad role, even you make everything is the right way, but the anesthesia can make some problems sometimes, because I see such cases in laser removal when you do not use any anesthesia on skin, on the body, and make everything good, it's okay. But if you use this, the probability of for complications are increased because you are change the inflammation process, and I don't like this really. I prefer work without
Vitaly, but I know one thing, usually permanent makeup artists, they apply anesthesia and they apply always plastic film, to make it better, So this way is really not good, I always say to my students not to apply any film, plastic film, because it goes too deep, and really, as you said, it can cause many difficulties, to perform procedures and healing and blah, blah, blah. But anyway, first pre-numbing we use, but not secondary, never. And the thing is, when you work with glycolic acid, the first pass is really a little bit painful, and you feel this different pH, of acid, and everything is to feel. So when we have this pre-numbing, it's okay, but, the second pass is absolutely normal later, and you already feel less. And the thing is like a miracle, this product starts to work like anesthesia. You don't feel anymore, So there are some interesting things during our procedures too.
Mm-hmm. Okay, I have applying of tattoo of some experiments. I know what the client feels when the tattoo machine works, when the laser works, even the chemical removal works. It's really normal feelings. It's not so horrible, painful, and something like this. No, you can tolerate, especially if you're a woman. Women are more tolerative to the pain than the men, and that's why I tried all of these procedures on myself, and I think everybody can cope with this. It's from my point of view, people who are yelling of the pain, it's more in their thoughts, in their scares, and they're afraid of this procedure. It's like more psychological problem. They read something in internet, they listen some videos about how it's painful, and they react in such way. In reality, it's not so painful. It's I really did all of this, and it's
I agree with you, and but you need to imagine if you work around the eyes, right? This special area always is a little bit, delicate, and that's why, we apply pre-numbing.
Skin of the area of the around the eyes is much more better blood supply and regeneration than even on all face, and that's why you in such case you can use this on the eyeliner and something like this, because even the inflammation go maybe in some different way, even some trauma will increase, the skin of the area around our eyes can cope with it. Even the surgical cosmetical operation of eye lifting and like this, almost always after such operation there is no visible scar, because regeneration of the skin in this area is perfect. I think it's the best regeneration on our skin of our body. That's why here you can use, but if you use it on the body, on the lower, on the leg, on the tattoo, you will have, I think, the very big risks. I want to tell such things. It's sometimes it's okay. In some cases, it's okay, but not. I try to explain. It's not safe in any way, in any place, in any situation. No, you need to decide every time in particular case what to do.
Okay. So usually, okay, since 1917, I started to have all these trainings abroad, so many students. But in this case, actually, prenumbing doesn't affect the healing so much or procedure, when you do chemical peel. So maybe if I will get one or two or three, some cases that it was going not in a good way, of course, I will agree totally with you. Absolutely.
I'm trying to prepare specialist to think in such way to avoid even probability, because okay, you can make the procedure 100 times, 200 times, 300 times, but you will get one complication and it will be very big problem, and it's better to avoid even chance of this. Do not go into the risk without the big reasons. If the pain is not so big painful, but big pain, why you need to use anesthesia? Even it's not make complications, not help to gain complications in big percentage of cases. It's so, but I see the reactions of anesthesia with the laser removal, and I have one by myself. It was ugly thing. It was very problematic, because if you're working years without complications and accidentally have a really very prominent and very hard complications, and you don't understand why, and only after all you can research and understand your client, the anesthesia, and you see the really threshold or line when you get complications with anesthesia, and without this you don't get, you will start to think, oh, maybe the reason, because it was really very interesting case, and it helps to my students to not do in this way and avoid such complications.
Do you agree that prenumbings are all the same, all the same?
No, not all the same, because there are a lot of some Korean, some Chinese numbing creams, and the specialists do not know the real ingredients and the real concentrations of the lidocaine, prilocaine, tetracaine, and all other substances in it, and sometimes it can be overdoses of this, and it can have some unusual reactions to the nervous system and something like this. It's one of the way. To my point of view, I advise to my students use something from aptic. I don't drugstores. It's official medical anesthesia like EMLA, like Creole, and the different names, because of the optimal concentration of lidocaine and prilocaine. It's called eutectic. I'm trying to say these words. Eutectic mixture. Yes, the concentration of 2.5% of prilocaine and 2.5% of lidocaine. And in such concentrations, such substances work better and in synergy than in different, even in more higher concentrations. It's proved, it's statistically proved, and it's, I think, to my point of view, it's safe, more safer than use unknown subnumbing cream from China without any labeling, without any ingredients, and it's, to my point of view, it's a very big risk to use such numbing from China or Korea in big big amounts and big jars.
Yes, I understand. We are living, in Europe, and the people who are living in USA, they trust pre-numbing very well. We have very trusted manufacturers, pharmacy manufacturers. But what I want to say, yes, we have different schools how to perform these procedures. Anyway, the thing is that we need to make it in the safest way. We need to do many searches. Believe me, not so much searches is in the tattoo removal field, right? You can find, some works. I'm looking always, for that. And that's why everything what we are doing now, it's like we are the soldiers in empty field, and we are doing our private searches in many cases. And but I'm really thankful for you that you always agree with me, to speak about, because we have sometimes different experience, but we not ignore each other, because I truly believe that laser and non-laser removals, they can work very successful together. And I'm really thankful that you share this knowledge. And I'm really hope that we will again meet us in other topics, because people are interested more and more in our conversations.
Thank you. Thank you for your invitation, and thank you for this discussion. Yes, we really not always, I not always not confirm, agree with you, but I can't ignore the situation. I can't ignore chemical removal. It's really used widely, and I know specialists in laser field who are strongly disagree with chemical. They hate chemical removal. I was the same maybe 5-6 years ago, but I see that it's possible to remove safely. It's possible to remove it in a good way, with good result, without complications. And that's why I can't ignore such fields, such method. And it's better to go deep inside and try to understand and explain to people how to use it properly. Thank you for this discussion.
Thank you very
Thank you for this live stream. And see you again. Thank you.
Okay, see you later.